Hi, my name is Chi Chen. Today I am presenting the case of Mrs. Teresa Mello. I will be covering her A2E assessment, outline the priority nursing intervention, and discuss the nursing consideration for her medication, including IV Ataplas, heparin infusion, and metoprolol. Mrs. Teresa Mello, she is a patient who experienced a sudden embolic stroke during her hospital stay. She presenting with decreased level of consciousness, slurred speech, and left-sided weaknesses. She was admitted to the hospital 2 days ago with dizziness, palpitation, generally feeling unwell. A 12-lead ECG diagnosed AF, and then she was transferred to a coronary care unit for cardiac telemetry review by a cardiologist who prescribed heparin infusion. She was due for discharge the next day. Upon assessment, starting from airway, Mrs. Miller's airway was clear and patent. However, embolic stroke can affect the brain region that control protective airway reflex. So with her situation of reduced consciousness and neurological deficits show that she is at a high risk of airway obstructions or aspirations. Moving on to breathing, Mrs. Miller's respiratory rate was 26 with shallow breathing. This tachypnea is likely a compensatory response to maintain cerebral perfusions, as the embolic stroke has caused sudden ischemia, impairing the brain region that regulates respirations, resulting in inefficient breathing. On accusations, air entry was equal on both sides but reduced at the bases, increasing the risk of CO2 retention, respiratory acidosis, which could worsen penumbra injury. Her oxygen saturation level was borderline at 95% on room air, so she is receiving 6 liters of oxygen therapy by Hudson mask with close monitoring of her respiratory efforts, oxygen saturation, and any sign of fatigue or failure on breathing to prevent further deterioration. Any decline would prompt escalation to the medical team. Moving on to circulation, Mrs. Miller, she was tachycardic at 136 beats per minute and hypertensive at 180 over 98, which is common in the early stage of acute embolic stroke as the body is attempt to maintain the cerebral perfusion, ensure blood flow to penumbra. Her peripheries are cool to touch with pitting edema in both feet, and capillary fill is under 3 seconds. So cool peripheries indicate vasoconstriction as blood is being directly to the vital organs, while the presence of edema suggested poor venous return, fluid overload, or even possible early cardiac compromise. So at this point, our plan is to avoid rapid BP reductions, as this could reduce cerebral perfusion. And Mrs. Mel, she requires continuous telemetry, monitor for hypoperfusion or heart failure, and also careful fluid balance because she's currently receiving heparin, which will increase the risk for fluid shift or bleeding. Moving on to disability, Mrs. Miller's GCS score is 12 out of 15, indicates a moderate impairment of consciousness, likely due to the embolic cerebral ischemia affecting the brain's ability to maintain alertness and responsiveness. Her pupils were equal and reactive, showing no sign of acute brain herniation. And based on her FAST skill assessment, Mrs. Miller demonstrates slurred speech, left-sided weaknesses, and left facial droop, reflecting like the reduced oxygen and nutrition supply from an embolic blockage affecting the motor control and speech parts in the brain. So her stroke onset time was approximately 1 hour ago. As deterioration can happen quickly, the onset time is vital to determine if Mrs. Miller is eligible for thrombolysis or thrombectomy. Moving on, Mrs. Miller's is a febrile with no wound or bleeding noted, which helped to rule out the possibility of infections. An IV cannula is inserted in her left cubital fossa, running Hartmann's at 20 millimolar per hour to maintain hydration and venous access. And also, given her left side weaknesses and reduced mobility, she's at a high risk of pressure injury. Um, Last but not least, on her assessment, her blood glucose level is stable at 5.5, so indicating no immediate glycemic concern. Moving on, the top four high priority nursing interventions for Mrs. Mellow's embolic stroke case based on the assessment. The first one would be airway protection and oxygen therapy. Because Mrs. Mellow, she has reduced consciousness and neurological deficits, so she's at a high risk of airway obstructions and aspirations. One nursing intervention is positioned her in the semi to high vowels to keep her airway clear. So she's also on a 6 liters of oxygen 5 Hudson mask, which helps keep her saturation above 95% of room air and also supports cerebral oxygenations and perfusions. Second nursing intervention would be frequent neurological monitor and stroke team activations. So we will need to do regular neurological check, including GCS and limb strength, so we can pick up on any early sign of deterioration or complication. If we do notice any changes, we would notify the stroke team straight away so that interventions like thrombolysis, thrombectomy can be initiated without delay. And add on to her airway protections, if her GCS score were to drop by 2 points or even more, that would be signal deterioration. And at that point, not only we have to notify the stroke team, we have to escalate to the advanced airway management and also call a rapid response. Thirdly, the cardiovascular monitor and blood pressure management. Mrs. Miller, she is on a continuous cardiac telemetry, and we will monitor her blood pressure frequently since she has AF and hypertension. So we want to avoid both very high and very low blood pressure because either could worsen her cerebral injury. And on top of that, the pitting edema means that we need to keep a close eye on her fluid balance so that we don't overload her circulations. Last but not least on nursing intervention is to prevent any secondary complications. Because of her immobility and neurological deficits, she is at high risk of pressure injury, DVT, and infections. So to reduce those risks, we regularly repositioning her, checking her skin assessment, encouraging early mobilizations as she's able to, and maintain hydration with IV fluid while being carefully not to overload her. So those measures all help prevent further complication and support her recovery. Nursing consideration when administering the medication to Mrs. Mello. The first one will be IV Adaplas. IV Adaplas is a thrombolytic agent that dissolves clots and restores cerebral perfusion in acute embolic stroke. So it must be given within 4.5 hours of symptoms onset. Prior to administration, coagulation, blood test, neurological status, and vital signs must be assessed, especially blood pressure. So during infusion, as nurses, we need to monitor closely for acute neurological changes or bleeding, including at the IV site, and escalate if concern arises immediately. Next medication will be heparin infusion. Heparin is an anticoagulant used to prevent new clot formation, which is particularly important for Mrs. Mello because her AF increased the risk of thrombus forming in her atria. Heparin dosage will be adjusted according to APTT, which is a blood test result to remain the therapeutic range while minimizing the risk of bleeding. Also, we have to monitor the platelets count to detect any HRT. Since heparin is given via infusion pump, we need to secure IV access. So as nurses, we closely watch for any sign of bleeding, such as bruising, gum bleeding, or blood in her urine, or neurological changes. Any abnormality finding are reported immediately to the medical team. Last but not least, Metapolo. Metapolo is a beta blocker that helps control heart rate and blood pressure, reducing the workload on the heart. So for Mrs. Mello, she was tachycardic at 136 beats per minute due to AF with a rapid ventricular response. Metapolo works by slowing her heart rate, allowing better ventricular filling and reducing the heart oxygen demand, which helps stabilize her cardiac status. Before each dose, her heart rate and blood pressure needs to be checked, and we take extra cautious if there is a history of asthma or heart block. It's usually given orally with food. As nurses, we also need to monitor for side effects such as bradycardia, low blood pressure, dizziness, fatigue, or any sign that her heart failure may be worsened. And we report this immediately. And that is the end of the presentations. So here is my reference list. Here is a reference list. Thank you.